Hi there, Dr. David Weintritt, breast cancer surgeon. Let's talk about the procedure called a Mediport placement. Some individuals diagnosed with breast cancer will require chemotherapy in order to achieve the best outcome and reduce their risk of recurrence. Chemotherapy can be a very important part of a patient's treatment plan, but these medications have to be very carefully administered. A procedure called a Mediport is an operation that we perform where a special reservoir called a chemoport or Mediport is placed under the skin. There are various locations. The most typical one would be in a pocket in the flat portion of a patient's chest below their collarbone. The port functions as a reservoir or access point so that when a patient goes in for chemotherapy, specially trained nurses will be able to feel it as a small bubble, and they can insert a needle into the port and administer the patient's medication in a very safe and consistent and reliable manner. So the procedure is done under sedation and local anesthesia. So you are in an operating room, you are not aware of what's happening, and it usually takes about 30 minutes. When I make an incision, the port will be placed, as I mentioned, in a pocket under the skin. The port will also have a catheter, similar to an IV, that will enter into a vein either under the collarbone or in the side of the neck. And that's how medication can go from the injection site, from the port, into your circulation and provide you the treatment that you need for your breast cancer. The port can be used almost immediately, in some cases even the day after it's placed. During the initial phase of healing, we put a waterproof bandage on so that patients can shower and quickly resume their normal activities and normal life. And when the course of chemotherapy is complete, ports can be removed in our office under local anesthesia, making it a very simple and safe part of your treatment. Some of the basic risks associated with placing a port: there are generic risks such as infection and bleeding. Those are both very infrequent. And there's a very specific risk when the vein, either under the collarbone or in the side of the neck, is accessed, called a pneumothorax, where there can be injury to the tip of the lung. Now, rest assured, these techniques and these procedures are very safe. We've performed them over thousands of times, and we've not had any of these serious complications, but it is important for patients having surgery to be properly informed, but also know and make sure that their treatment team is doing everything possible to reduce these complications and provide this service when they need and provide it safely.